We begin with major public health news in the pandemic fight that affects all of us. The newly tooled coronavirus vaccine booster shots are starting to be rolled out in both Kansas and Missouri. We know the Kansas City, Missouri Health Department and many others expect to get some this week. Doses are already at some pharmacies before a wider rollout begins for community health centers and doctors' offices across the country. These new boosters are specifically designed to better protect you against the newest Omicron strains of the virus, which are causing the majority of new infections right now. You do have to be at least 18 years old to get Moderna's version. The Pfizer booster is cleared for anyone 12 and up, and experts say the timing to get your next shot is flexible after your last vaccine dose.
There's no magic number when it comes to thinking about the spacing for the next booster. 2 months is the minimum, and it's especially important for those that are high risk to make sure that they get that protection ahead of any possible fall surge.
That's the key. Fall is 11 days away, and doctors want to get vaccination numbers up before everyone starts gathering indoors again. So they're in a battle against time and hesitancy. Still, now nearly 2.5 years into the pandemic, just less than 50% of the U.S. population is fully vaccinated with a first booster dose. In Kansas, it's 46%. It's nearly 45% in Missouri. Let's discuss the rollout and the challenges that still exist. Please welcome Dr. Alex Francisco with the Kansas City, Missouri Health Department. Thanks so much for being on the program. Today is Sunday. You expect the shipments this week. What's your plan moving forward?
You know, we just need to get the vaccines in the arms of all the folks who need it. As you just saw, the numbers are relatively low for the first dose of the boosters in Kansas City in particular. You know, we have a big spread throughout the age groups, and so there's going to be a real push to get those vulnerable populations vaccinated with this new booster after they've completed their first scheduled doses. And then, you know, moving into the fall, we're concerned about spread in schools and getting kids vaccinated with that booster as well.
You mentioned vulnerable populations. What's the most vulnerable that you're seeing?
The most vulnerable population throughout the pandemic has been the elderly population. They're the ones who are most likely to die, and then folks who have, folks who have several different comorbidities, so risk factors, things like being overweight, things like cardiovascular disease. All of these factors can really play into how severe COVID is for a lot of these folks. And so anybody who has those risk factors should definitely be first in line to get this booster.
Still getting a lot of pushback? I mean, we see the numbers here. Why do you think that is? And how do you overcome that?
Yeah, in Kansas City in particular, we have a really big difference in the age groups. So the most vulnerable folks see the severity of the disease and have been vaccinated. You know, our vaccine rate for those over 65 is roughly 99%. And so there is hesitancy around the vaccine because a lot of folks don't perceive it as being something that's impactful to them. You know, they don't see it as a danger, and they haven't necessarily seen the ill effects directly affect them. But those who have seen that, those who know folks who have died, they do see that it's a bad thing. You know, COVID is a bad thing, and they'll be more likely to get vaccinated, but it's just getting that impression to these folks as best we can.
That's the uphill battle. Yeah. You know, we've seen a lot of Omicron-based infections, right? That's the dominant strain and sub-strains of the virus. Why is this needed right now, do you think?
So this most recent strain, Omicron, is much more virulent than the other ones have been. It spreads much more easily. You know, last January, when we had the height of the Omicron wave, we had over 20,000 cases in Kansas City in a single month. Prior to that, we had only had roughly 70,000 cases total. Wow. And so it was really, really severe, really quickly. And so anything that we can do to try to limit that spreads so rapidly is going to be really important.
Are you ever going to bring back drive-through clinics, or is the interest too low to even do that?
There are still some drive-through clinics.
Okay.
There are some walk-up clinics. You know, I know that there are a few places out there where you can get those. You know, I know you can get some at UMKC, and so I don't know if we'll ever bring that back with the health department, but you can always walk in to get your vaccinations whenever you need to at the health department.
A couple questions, and we're running out of time here. How long after getting COVID should you wait to get this booster? And we know that you're concerned about the fall. You have flu season too. Can you do both shots together?
You can do both shots together. There are some differing recommendations on how long you should wait after you have COVID to get vaccinated. You know, I would just consult your primary care physician, your doctor, talk to your doctor about that. but our suggestion would be probably 2 to 4 weeks, 2 to 4 months after you have COVID.
Okay,
Yeah.
and after the other booster, it's a shorter amount of time, right?
Yeah, it should be. But again, just talk to your doctor about that. Make sure and follow their recommendations. There might be some specifics that they're going to tell you that we're not going to be able to tell you.
All right, well, we'll be following your progress, Dr. Alex Francisco. Thank you so much for your
Thank you.
time. Thanks for coming on the program today.